Hi everyone. In today's session, I'm going to be talking about posture, manual handling, and how these relate to lower back pain. Posture is a term that's used to describe the position of the body or arrangement of body parts in relation to one another, and there are two main types of posture. The first is inactive postures. These require minimal muscle activity and are usually adopted when resting or sleeping. We then have active postures, which are divided into two subgroups, static and dynamic. Static active postures involve the interaction of various muscle groups that contract without moving to counteract gravity and other forces. Examples include standing, sitting, lying and kneeling. Dynamic active postures are when muscles and ligaments work together to form an efficient basis for movement. Examples are walking, running, jumping and lifting. Changing position frequently is vital to our health and has many benefits. These include minimising the progressive strain on muscles, tendons and ligaments, and therefore preventing aches and pains. In turn, this distributes the workload amongst your muscles, which can minimise fatigue. Frequent movement also helps to keep you more alert, leading to increased energy and productivity, as well as improving circulation throughout the body to allow your tissues to get nutrients. Staying in one position for a long time can cause pain, and this is due to prolonged stress on the body's tissues, such as the joints, muscles, tendons and ligaments, which can eventually lead to increased strain and possible deformation on the tissues. We all have receptors in our body which send signals to activate our postural muscles as we move. Prolonged posture will inhibit these signals, meaning we then rely on our ligaments to hold us up. This may cause a pain response and potentially lead to back and neck dysfunctions. In a recent study, slump postures whilst watching TV and using the desktop computer were associated with chronic lower back pain. In order to prevent back and neck pain associated with prolonged postures, we have some tips for you to help you keep moving when you're doing various tasks. When sitting, try to change your position every 20 to 30 minutes to prevent stiffness and pain. At work, it may help to put the office telephone or printer or photocopier on the other side of the room so that you're forced to get up and move. You may find it helpful to set an alarm every 20 minutes to get up. Many fitness watches and trackers on the market do this automatically. Having a reminder to move or stretch can also be beneficial. For example, every time the kettle is boiling or the adverts come on the TV. When driving, if you are planning a long drive, allow time for breaks so that you can move, have a quick walk and stretch before recommencing your journey. You can also use time stopped at traffic lights by stretching to reduce muscle tension. When you are sleeping, the most important thing is to be comfortable. There is no such thing as the perfect mattress. Some people find an extremely firm mattress is more comfortable, whereas others prefer a softer one. It is up to you. The most important thing is to sleep as well as possible, which will help to reduce stress, tension and pain. The majority of people require 7 to 9 hours of sleep per night. I'm now going to move on to talking about manual handling. When thinking about manual handling, it really comes down to common sense and context. Some people get very nervous about lifting things without a perfect technique or posture, But like we've previously mentioned, there is no such thing as a perfect posture, and this also goes for lifting techniques. Like any exercise, you have to work with what your body is used to or adapted to. Bending your back is perfectly normal and okay, and there is a lack of evidence that any specific spinal posture when lifting is a risk factor for lower back pain. In fact, there is only a 4% difference in pressure on the discs between a stoop and a squat lift, much less than what most people expect. If the object you're lifting is fairly light and something that you do regularly, a stoop lift is going to be okay. If it is something very heavy and something that you're not used to lifting, a squat lift is likely to be less aggravating and also allows you to use your stronger leg muscles. Before you progress to lifting large heavy objects, let your body adapt by practicing lifting smaller and lighter objects first. You wouldn't ask your legs to run a marathon without training for it, so why ask your back to do more than it's used to doing either? Key points to remember when lifting are to love your load. This means keeping the weight close to your body when lifting and carrying things to keep the work to a minimum. And spread the load, which describes how it's okay to bend our backs when lifting, but also to use your legs too to make it easier. And remember, exercise is one of the most important things to consider when trying to manage back or neck pain. Programs involving muscular strength, flexibility, or aerobic fitness are beneficial for lower back pain. And in a recent study, posture-related shoulder pain, mid-back pain, or lower back pain were relieved with an exercise program.